Hey, how's it going? So, coming at you today with another video for a Heart for Hearts, which is a brand that I created uh, with the sole objective of trying to bring awareness to the issue of women's heart health. Because if you weren't aware of it, it is the leading cause of death in our women today. And one of the major factors in that is a lack of awareness. And this is obvious in the statistics. And if you're not familiar with my story in this channel. My name is Brad Casper, and 4 years ago, we lost our mother to a major heart attack, and she was only 60 years old. And needless to say, that was devastating for our family. But even more so to find out after the fact that there was a good chance that it was preventable if we had only known the information. And so there isn't much I can do about that now, but what I can do is to make it my goal and my mission to try and bring as much awareness to this topic as possible in honor and memory of my mother so that other women won't suffer the same fate and other families won't go through what we had to go through just because of a lack of awareness. And so anytime there's new information that comes out about this, I like to pause and try and wrangle it in and bring it to the forefront, hopefully so that you can become aware of it, just because the nature of the headlines today, it's there 1 minute and the next minute it is gone and buried by all the next headlines. And so if you missed it, there's a good chance you will never know about it. And so that's what we're doing here today. This new information was published. I seen it come out last week. And, most of us aren't looking in scientific literature just as a hobby and something to do. And so, unfortunately, that's where these things are at. And so, hopefully, what we can do is to try and make it a little more digestible to you in this video format and present it to you in a way that hopefully you can take the information and be at least a little bit more knowledgeable on it. So, that's what we're doing here today. This article starts out by saying scientists say women face this hidden heart attack risk even with normal test results. Heart disease is the leading cause of death in America, making prevention crucial. But new research suggests there's a heart attack risk factor that women face. A study found that women may experience heart attacks in major adverse cardiovascular events, also known as MACE, with lower levels of plaque buildup in their arteries than men. The study, which was published in the journal Circulation, Cardiovascular Imaging, and this is what I mean, it, I doubt many people are out there reading such journals. But anyway, it is raising a lot of questions about heart disease prevention in women and whether more intensive interventions are needed. For the study, researchers analyzed data from nearly 4,300 people with no known prior coronary artery disease who sought help for chest pain. The researchers analyzed computed tomography images, CCTA images, that measured total plaque volume and total plaque burden, also known as TPB, or the amount of plaque relative to the size of the blood vessel. Plaque is a waxy buildup of cholesterol, fat, calcium, and more that accumulates inside the arteries. Plaque buildup restricts blood flow and raises the risks of heart attack and or stroke. Now, the experts here that were involved in this paper, Kevin Shaw, MD, cardiologist and program director of heart failure outreach at Memorial Care Heart and Vascular Institute at Long Beach Medical Center in Long Beach, California, and Navjot Sobti, MD, hopefully I didn't butcher that too bad, interventional cardiologist and women's heart health specialist at Northwell's Northern Westchester Hospital and Katz Institute for Women's Health. While the research found that women had lower amounts of plaque than men and less plaque with characteristics that were considered high risk, they still had similar rates of major adverse cardiovascular events over 26 months compared to men. To put it more plainly, heart risk in genetic women rose when plaque burden reached 20%, whereas in men, it rose when it reached 28%. And it's like these little details right here that can literally be the difference between life and death. And so it's crucial that we understand these type of things. The risk of major adverse cardiovascular events increase more steeply at lower levels of plaque than men, while the risk of these cardiovascular events increase more gradually in men and required higher levels of plaque. The researchers wrote in the study's conclusion that the findings suggest there should be sex-specific interpretation of plaque measurements for timely intervention in women. So why does this happen, and what does it suggest for heart disease prevention in genetic women? Here's what cardiologists want you to know. Why might women have higher risk of cardiovascular events with lower levels of plaque? The exact reason for this isn't clear. While the study found that women were more likely to have the same risk of major cardiovascular events at lower levels of plaque buildup, it didn't explore why. The theory is that females, on average, are smaller than males, and their heart sizes are smaller. But the actual metric with plaque volume tries to adjust for the size of the blood vessels. Because of that, it's hard to chalk it up to the size of the person or the size of their heart. But heart disease tends to show up differently in women, points out the doctor. Additionally, women have been historically underrepresented in cardiovascular research. Many risk thresholds and imaging cutoffs were developed using male populations and focus on finding large artery blockages, aka obstructive disease. But women are more likely to have non-obstructive disease and types of heart attacks that don't show large blockages on heart imaging. In many cases, women develop heart attacks or heart disease from issues like coronary artery spasm, a spontaneous coronary artery tear or dissection, SCAD, or problems in the heart's small blood vessels, conditions that don't show up as major blockages and are often missed by traditional heart disease risk models. As a result, women can have serious heart events at lower levels of visible plaque, highlighting the limitations of a one-size-fits-all approach and the need for sex-specific risk assessment and prevention strategies. Sex-specific risk assessment matters. How can I lower my risk of heart attack? Everyone should follow the American Heart Association Life Essential 8, which are steps designed to improve and maintain cardiovascular health. But there should be a greater emphasis on these if a female patient has some plaque volume detected. Even mild coronary plaque in women may increase the need for earlier and more aggressive prevention methods like statins, blood pressure control, and lifestyle interventions, along with proactive screening like coronary calcium scoring and so on. While a conversation with a cardiologist is essential, here's what the AHA suggests people do to lower their risk of heart disease. Eat a diet that consists of whole foods, including fruits and vegetables, lean protein, nuts, and seeds. Aim to get 2.5 hours of moderate intensity exercise or 75 minutes of vigorous physical activity a week. Avoid tobacco. Try to get 7 or more hours of sleep a night. Do your best to maintain a certain weight. Try to manage your cholesterol by limiting sugary foods and drinks, red and processed meats, salty foods, refined carbohydrates, and highly processed foods. Do your best to manage your blood sugar and stay on top of your blood pressure. The bottom line: while more research is needed, experts say these findings are meaningful. Dr. Shaw says that this is an important finding, noting that more cardiologists are scanning patients for plaque buildup. These studies inform us that men and women are different in terms of plaque. As always, consult your physician for more tailored recommendations. And so, yeah, that's the gist of this whole article, folks, is that they're realizing now that this isn't a one-size-fits-all approach when it comes to testing and imaging for plaque buildup. And so they're understanding now that it looks much different in women. And due to that, it may involve and require more detailed testing and heart imaging. And so hopefully that is something that gets pushed in and mandated within the prevention protocols that they're currently doing for women that are middle-aged and dealing with these type of issues. But again, the main thing is just being aware of these type of topics and understanding this new information as it comes out. And so hopefully that's what we've done for you here today. Hopefully you're walking away a little bit smarter when it comes to the topic of heart health and understanding that in many ways, this looks a lot different in women. And so we need to get away from a lot of those old ideas that, heart attacks and the symptoms of those look the same as in men as they do in women, because that's just simply not true. And so it's good to see that we're finally breaking away from that way of thinking, and hopefully we can start to bring these numbers down by trying to bring this, more awareness to these topics in the future. So hopefully that's what we've done for you here today. Like I said, my name is Brad Casper. This is Casper's Corner. And if you're interested, I did do another video. I'll link it here at the end about a new finding when it comes to hormone replacement therapy in middle-aged women that are approaching menopause. Check it out. I think you may find it interesting. And the numbers are staggering with the percentages of the benefits that they're seeing from it. So like I said, it'll be here somewhere at the end. Check it out. And if you haven't yet, please like the video and subscribe to the channel. And when these things come up, I will be sure to bring them to you whenever I see it. So thanks for being with me today. Till the next one, we're out.